Imagine being admitted into the hospital because you're seriously ill. Your nurse is caring, skilled, and experienced, but she is also responsible for too many patients at the same time. While she's helping one patient, she's having trouble breathing. Another patient needs pain medication. Someone else is trying to get out of bed, and the fourth condition is beginning to change. The nurse knows what every patient needs, but she cannot physically be in four rooms at the same time. The situation is not simply inconvenient, can become dangerous. When nurses are assigned more patients than they can safely manage, assessments may be delayed, medications may be late, and subtle warning signs may be missed. As a nursing student and a medical assistant who's worked directly with patients, I've seen how much patients depend on healthcare workers to notice changes, communicate concerns, and respond quickly. This is why this matter is personal, matters to me personally and professionally. Today, I want to persuade you that hospitals should maintain an enforceable unit-specific nursing staffing standards and give bedside nurses a meaningful role in staffing decisions. Safe staffing protects from preventable harm, reduces nurse burnout and turnover, and creates more stable healthcare systems. First, nurse staffing is a patient safety issue. Nurses do much more than complete a list of tasks. They continuously assess patients, administer medications, provide education, prevent falls, communicate with providers, and recognize when a patient's condition is getting worse. Every additional patient divides the nurse limits and time and attention even further. According to 2021 studies by Lassiter and colleagues, each additional patient added to a nurse workload was associated with 12% higher odds of an in-hospital death and 7% higher odds of death within 60 days among patients hospitalized with sepsis. The study also connected heavier workloads and higher readmission rates and longer hospital stays. The number is important because sepsis can progress quickly. A delay is recognizing confusion, low blood pressure, breathing changes, or reduced urine output may affect whether the treatment begins in time. The nurse must have enough time to notice these changes and act on them. In 2022, systematic reviews by Della Ora and colleagues examined longitudinal studies of hospital staffing. The research concluded that the higher registered nurse staffing was associated with lower hospital mortality. In other words, the connection between staffing and outcome appears to across more than one hospital or one isolated study. Unsafe staffing also creates missed care. A bath or education session may seem less urgent than medication, but missed care adds up. Patients may not understand discharge instructions, may remain in one position too long, may attempt to walk without help. Adequate staffing allows the nurse to provide complete care and consistently deciding what's necessary tasks must wait. Transition is unsafe staffing harms patient and also affects the nurse expected to work under those conditions. Second, chronic understaffing contributes to nurse burnout and turnover. Most nurses enter the profession because they want to help people. However, when a nurse repeatedly leaves work knowing that important care was delayed or unfinished, that creates exhaustion and moral distress. The problem is not that the nurse does not care enough. Often they care deeply, but being asked to do more than one person can safely accomplish. The National Council State Boards of Nurses reported in 2025 that more than 138,000 nurses had left the workforce since 2022. It is also found that 39.9% of registered nurses said that they intended to leave workforce to retire within the next 5 years. Among nurses planning to leave for reasons other than retirement, approximately 41.5% identified stress and burnout as a root cause. I don't know if you guys can see it, but it's showing the 138,000 and 39.9. This creates a cycle of understaffing, increases stress. Stress pushes experienced nurses away. Their departure leaves fewer nurses to care for the same number of patients, which makes the remaining staff even more overwhelmed. Hospitals may depend on overtime, temporary staff, or nurses who still learning the unit. That inability affects teamwork, communication, and continuity care. Patients benefit when experienced nurses remain at the bedside. Experienced nurses recognize the pattern, anticipates complications, and supports newer staff members. Retaining them is not only an employment issue, but is a part of maintaining staff and reliable patient care. Transition, because the effect reaches both patient and nurses, hospitals, and more than short-term staffing fixes. Third, hospitals should use the enforceable units' specific staffing standards and include patient equity besides nursing input. This does not mean using identical numbers for every hospital unit. A stable patient preparing a discharge does not require the same level of nursing attention as a patient receiving intensive care or a patient whose condition is rapidly changing. A safe policy should include a maximum patient assignment appropriate for each type of unit, methods of adjusting assignments when patients have greater needs, and process a bedside nurse to report unsafe conditions without retaliation. Staffing committees should include nurses who actually work on the affected unit because they understand the workflow and what the patients need firsthand. Some people argue that enforceable standards should cost hospitals too much or reduce flexibility. Cost is a real concern, but unsafe staffing also has costs. Turnover requires hospitals to recruit and orient replacements, preventable complications, and extend hospital stays. Heavy reliance on overtime and temporary staffing can also be expensive. But most importantly, flexibility should never mean assigning a nurse more patients than they can be cared for safely. Standard preserve flexibility by considering acuity, admissions, discharge, staff experience, and available support personnel. The goal is not to remove professional judgment. The goal is to create safety boundaries so that that financial and operation pressure does not override the patient's need. In conclusion, the nurse staffing protects patients from delayed or missed care, reduces burnout, that drive nurses away from the profession, and strengthens the ability of the healthcare system. Research shows that heavier patient assignments are associated with the worst outcomes, while the nurse and enforcement continues to report serious stress and plans to leave. Everyone of us may eventually become a hospital patient, or we may sit beside someone who we love, who depends on a nurse to recognize that something is wrong. In that moment, we will not want our nurse forced to choose which patient receives attention first. I'm asking you to support enforceable unit-specific staffing standards, patient acuity adjustments, and a real voice of bedside nurses in staff decisions. Safe staffing is not a luxury for nursing. It's a basic patient safety requirement. Thank you.